Next on Worcester News tonight, a packed room in Worcester as nurses explain their stance on how people should vote for question 1 in November's election. Plus, aiming to prevent deaths and serious injuries along railroad tracks. The city partners in the new effort to keep railways safe. Good evening and thanks for joining us. I'm Olivia Lemon. A packed house at the First Baptist Church in Worcester Wednesday night as nurse advocates debate the issues surrounding staffing levels at hospitals. The forum discussed ballot question 1, which would limit the number of hospital patients assigned per registered nurse. Supporters say it would provide equal quality health care for all. Opponents say it would increase health care costs and have a high price tag for hospitals. Donna Kelly Williams and Teresa Rincon, 2 registered nurses, discuss their roles and why they support different votes for question 1.
This is about nurses' ability to be able to take care of their patients safely. And this is about making sure that when you or your loved one is in the hospital, that nurse can safely take care of you by having a safe limit in place to be able to take care of their patients.
I learned that nurse-to-patient ratios, when they were implemented in California, did not improve outcomes for patients. They increased cost of care without improving the outcomes for nurse-sensitive measures that we as nurses thought that they would improve on.
And this question will be on the ballot on November 6th. Tonight's event was sponsored by the Worcester League of Women Voters. 2 Worcester-based companies have agreed to pay a total of nearly $200,000 to settle allegations they engaged in or allowed illegal asbestos work during the renovation of 2 Worcester homes. Attorney General Maura Healey says illegal asbestos work can pose serious risks to the public health. The lawsuit by the AG's office is against Capstone General Contracting and its subcontractor Simulus Plumbing and Heating. Healey says they violated state law at one of the homes by illegally removing asbestos-wrapped heating pipes, stripping the pipes of asbestos, and improperly disposing of the material. A water main break in Worcester leaves some with little to no water Wednesday night. The break happened on West Boylston Street, just across from Lou Rock's Diner. DPW crews were on scene well past dark, digging to repair the damaged main. Residents in the neighborhood may experience rusty water, low water pressure, or no water at all. Worcester DPW says they're investigating the cause of the break. They warn people to check their water before using. The City of Worcester and Federal Railroad Administration recognize Rail Safety Week. The goal is to eliminate trespassing and serious injuries, sometimes death, on local train tracks.
More than 500 people in the United States died last year as a result of trespassing on a railway. Another 500 were injured.
Trespassing deaths on railroad tracks are increasing at an alarming rate in the United States, and that's why we're here.
Wednesday is National Trespass Prevention Day. The city was awarded a grant of $93,000 from the Federal Railroad Administration. The money will allow the police department to enforce the trespass prevention program.
While the goal of this program is to reduce the number of trespasses on the rail lines, we will also be addressing quality of life issues such as trash volume along the tracks, graffiti, and homeless encampments.
Worcester reached out to the Railroad Administration in 2015. Members of the Maine-South Alliance for Public Health reported kids using train tracks as a dangerous shortcut.
A loaded freight train going 55 miles an hour on a flat, dry surface, 18 football fields, or 5,280 feet, a mile or more to stop.
The city held a press conference on the tracks behind 44 Hammond Street, one of the 8 spots identified as problematic trespassing spots. For the fire department, calls on the railways are not uncommon.
Whether it's trash burning or EMS calls for overdoses or people just being injured by the train. So this is very important for us.
The city is one of 4 to receive such a grant. The hope is law enforcement can help deter people from the train tracks.
This money is going to go exactly to what we need to, which is about saving lives, because even one life lost is one too many.
Now, Chief Sargent says members of the police department's crisis intervention team will help enforce these trespassing laws. Next spring, every 2 to 3 days, Worcester Police will be patrolling these areas. Olivia?
All right, thank you, Cam. Dozens gathering tonight at the Hanover Theater to share uplifting stories about beating cancer. Pink Revolution's Lighting the Way for Women's Cancer event discusses many different things from living a healthy lifestyle to self-breast checks and mammograms. The annual event features physicians and researchers in women's cancer at UMass Memorial who highlight the advances being made in research and patient care.
This event allows us to really touch on the full 360 of the patient being diagnosed to their journey of being a survivor, and talking to the medical professionals that helped save their lives and then their loved ones who supported them. So tonight is really a reflection of the whole circle of that community coming together.
In October marks Breast Cancer Awareness Month, but organizers say it's always a good time to remind women and men to get checked. Tuesday night, Worcester City Councilors approved the financing plan to build a stadium for the Pawtucket Red Sox. The $100 million loan was the final approval needed for the city to break ground on the 10,000-seat Polar Park. The vote was 9-1 in favor of the deal. The city can now hire a project manager and start working on designs for the Madison Street site. Mayor Joseph Petty says the timeline they are on requires half of the construction to be completed by January of 2020. Pawtucket Red Sox President Charles Steinberg weighed in Wednesday on the vote. Dr. Steinberg says the approval opens the door for the community to help with the stadium's design.
Now is the time that we'll begin our fan plan meetings and tell us what you want in a ballpark. If you're a mom bringing a 2-year-old and a 6-year-old, what do you want? If you're someone bringing an octogenarian to the game, tell us what you need.
And Steinberg says the AAA baseball team wants to make sure the park is welcoming to everyone in the city. UMass Memorial Medical Center announcing it will discontinue outpatient psychiatry and outpatient physical therapy starting in January. Hospital spokesman Tony Berry says the cuts are due to declining volume, inability to provide sufficient patient access, and sites unsuited for the psychiatric care. They will impact the Hanneman campus and on Queen Street. The outpatient physical therapy service will also be closed on the Hanneman campus. A new 120-bed psychiatric hospital is set to open in January in Worcester. UMass Memorial Healthcare is exploring a new outpatient physical therapy service in Shrewsbury. UMass Memorial Healthcare is also reporting a $22 million loss on operations due to lower Medicaid reimbursements. A marijuana business is taking Charlton to land court. In May, Charlton selectmen approved host and developed agreements with Valley Green Grow. The company plans to build a $100 million medical and recreational marijuana operation on Charlton Orchards lands. Valley Green Grow's attorneys say their lawsuit looks at the legality of the proposed general bylaw from a citizen group to ban recreational marijuana in town. The company argues in Massachusetts, a zoning bylaw can't be changed this way. Charlton residents had voted in favor of adult use marijuana in 2016. A team of computer scientists at WPI are developing a phone app which could assess the health of soldiers. According to researchers, sensors in a smartphone would collect data to detect the signs of medical conditions with the goal of finding potentially severe illnesses at their earliest stages and alerting soldiers to get treatment. The Defense Advanced Research Project Agency is supporting the work with a 4-year, $2.8 million award through a program called Warfighter Analytics using smartphones for health.
So the idea is essentially that the soldier has zero interaction. So the phone is completely gathering all this data and then pushing it to the cloud where it's analyzed and make inference and say who has increased risk that they have TBI or infectious diseases.
It's also critical because they don't see a doctor very often. They are in an environment where there might be not easy access to medical attention. And so even if they saw them every 3 months or every 6 months, that would be way too late to detect some of these things.
And researchers will be conducting a study in the future where they'll collect data from 100 volunteers and later test on a larger scale. All participants in the data gathering studies for the app will be voluntary and all data is confidential.